extending this out from our district here in Central Harlem all throughout the city. You know, I want to first extend my deepest condolences to the individuals that have lost their life in this unfortunate epidemic. And my prayers are also with those who are currently recovering from the illness and those frontline workers who are providing the care and support that we desperately need at this time regarding Legionella and Legionnaire's disease. I want Harlem residents to know that my office is working closely in coordination with the Mayor's Office and the New York Department of Health and Mental Hygiene to ensure that every contaminated cooling tower is remedied immediately. Every contaminated cooling tower is remedied immediately, and that ongoing testing is conducted throughout Harlem, and that the residents, especially our seniors and people who have immunocompromised bodies, receive the timely information that they need, that they can access testing, and that they can get the appropriate medical help that they need. And I urge all residents experiencing flu-like symptoms, this is what we know about this disease. If you have flu-like symptoms, if you feel like you got a little cough, this is not the time, and I'm gonna say this is a little bit off script, but I know how we are as a people. This is not the time to say, let me just go to the grocery store and get some ginger ale, and let me lay up somewhere. This is the time for you to actually go and seek medical attention. That's how serious this is. Those who are over 50, especially with underlying conditions, we need to make sure that they are vigilant. I'm at 51, I still feel like I'm a young person, but I'm at 51. So if I had any kind of trickle of anything, I'm in that group. I need to make sure that I'm vigilant and understand that I need to seek medical care, just like those individuals. If you're experiencing something, seek that medical care immediately. Our health is non-negotiable. Harlem is united, and here with our Senator, One Harlem is in the House. Harlem is united, and I stand here with the Honorable Senator Cordell Cleare, New York State Assemblyman Wright. I'm joined by Deputy Mayor and Health and Human Services, Suzanne Mal Gustave, and Active Health Commissioner, Dr. Michelle Morse. And so I want to first pass the mic to our Senator Cordell Cleare.
Thank you, Councilmember, and thank you, Health Commissioners and my other colleagues who are here. You know, as we are monitoring this disease and we're monitoring the cases, the new cases that are coming up, one of the things that's very important for us to do is examine and find out why this keeps popping up in Black and brown communities. This is a plague that seems only to affect us in our community. We need to find out what those gaps are. What is it that's being neglected? Our health should not be compromised because of a maintenance issue.
That's right.
This is something that has to be pinpointed. We have to understand, perhaps, you know, there are new regulations that are in order. We know that the temperature is getting warmer and warmer. Our climate is getting warmer and warmer. It is my understanding that Legionella thrives in warm water. So we have to adjust things to make sure that we're not putting people at risk. We have to make sure that we are taking proactive measures and not waiting on human beings to be the guinea pigs, to be the canaries in the coal mine, if you will.
That's right.
We have to figure out how to prevent deaths. 3 deaths, 1 death is too many. Not to mention the fear and anxiety that exists in our community, especially among our older New Yorkers, who are the most vulnerable. Like our council member said, if you're experiencing symptoms, please get to a doctor right away. Make sure that you check yourself out so you could have the earliest possible chance at treating Legionella. But in addition to that, pay attention to what's going on around you. If you have neighbors that are sick, your mom, your father, older New Yorkers, let's be there for them. But at the same time, we have to make sure we're doing every single thing we can to monitor this. This is why on August 6th, I have introduced a new bill. Just with the limited information that we have, we want to strengthen New York City's laws with respect to cooling towers, which are the perennial breathing ground and cause of Legionnaire's disease. This legislation will make 5 major reforms, including requiring immediate mitigation, more frequent testing and inspections, and even increasing fines if there are violations. This is too important. This is our lives we are talking about. Yes. So we want to make sure that there's no measure and no action that's too strong to save lives. I want to thank Councilmember Yusef Salaam for putting this together, and my colleague here, Jordan Wright, Assemblymember Jordan Wright, and the community boards 9, 10, and 11, who will be joining me for a virtual webinar on Legionnaire's disease coming this Tuesday at 6 p.m. I want to thank the Department of Health for their cooperation, because the most important thing right now is information, and people need information. We need to know what's happening. So thank you so much. And will you be introducing the next speaker?
Yes, indeed.
Okay, thank you. I'm sorry.
Thank you.
Okay.
Thank you, Senator. We'll now hear from the Assemblyman Jordan Wright.
Thank you so much, Councilmember Salaam. Thank you so much, Senator Cleare, all my partners in government that are here today from the Health Department. There's not a lot I can say differently than has been said already, but there are a couple salient points that I'd love to make. Number one, this is historic right now for the council member, the assembly member, and the senator to be here working together. We're all here together as one, making sure that our community is informed, that our community is taken care of. I think that is key. Number two, I want to thank the members of the community that are here. We rely on you to ensure that everyone else knows what's happening. You can report it back to your buildings, report it back to your communities, your personal constituencies, so we can all work harder to build a better community. Senator Cleare was talking about some legislation that she has coming down the pipe. I look forward to hopping on the legislation with her. There's been a lot going on in the Assembly, a lot going on in the Senate, in the state that affects our community, and that bill is a great idea, something that I look forward to championing with her. So thank you so much, Senator Cleare, for putting that forward. And finally, I just want to say it's important to know that, this is not the end. There will be an end to this. There will be a remedy. There will be a fixture, and we will make sure that we get past this as a community and to make sure that we continue to thrive. We all have long lives to live. However, like the council member said, if you feel like you got a cough, if you think you have a fever, I'm not a doctor. I recommend you go see a doctor. Go check on yourself. Listen to your body, and nobody knows yourself better than you. I'm Assemblymember Jordan Wright. Thank you all so much for being here. Couldn't turn back to my council member, Yusef Salaam now. Thank you so much.
Thank you, Assemblymember. Now we'll hear from our Deputy Mayor.
Thank you so much. Thank you. We have members from the Senate, the Assembly, and the Council, to your point, working together as one. We have the Mayor's Office and we have the Department of Health. And I will pass this over to our Acting Commissioner, Michelle Morse, who will give you all the information you need to know. But as you know, the New York City Department of Health, one of the largest public health agencies in the country, they have your best interests at heart. They know what they're doing. They are true professionals. So we're here to make sure that you all hear the information and understand what you can do in response to this crisis, right? We're taking this very, very seriously. This administration takes it seriously, and DOH takes it seriously. So I will then pass this to Dr. Morse, who will give you the information you need to pass on to your families and friends. Thank you so much.
Thank you so much, Deputy Mayor. Thank you to Council Member, Assembly Member, Senate Member, and everyone who's here today. My name is Dr. Michelle Morse. I'm the city's doctor. It is a real honor to make sure that the information is getting to this community. This is my top priority right now. And 3 deaths is unacceptable. We know that we have more work to do. I want to start by telling you that all of the towers that have tested positive have been treated with antibacterial treatments to end the spread of the bacteria. That was done last week. It was done urgently because we know that this bacteria grows quickly and can spread quickly. So that's the first most important thing that you need to hear from me, is that we sprung into action with our inspectors as soon as this was detected to make sure that every cooling tower was tested and treated, if positive, immediately. immediately. I also want to tell you that as of today, 73 people have been infected, unfortunately, with Legionella bacteria, and 3 people have passed. 23 are currently hospitalized. This is tragic, and any loss of life is too much. I offer my deepest condolences to the families and loved ones of the deceased. At the health department, we are doing everything we can to minimize future cases and avert any further deaths. Legionnaire's disease is caused by Legionella bacteria and grows in warm water. It cannot be spread from person to person. Again, I want to make sure everyone hears that. This disease, this bacteria does not spread from person to person. The most common place for the bacteria to grow is in cooling towers, which are on top of buildings. These cooling towers spray mist or droplets, and that mist is outdoors and can carry bacteria. Right now, the risk to Central Harlem community at large is not limited to any specific buildings. That's right. I want to emphasize again that there isn't a specific building, and I want everyone to be clear that the 5 zip codes in Central Harlem that are currently under investigation are the 5 zip codes of focus. It's a false sense of security if I were to tell you any 1 or 2 or 3 specific buildings to focus on. The entire 5 zip codes are under investigation actively. Cooling towers do help to cool equipment and regulate building temperature, but that system is separate from indoor plumbing or water tanks. Those are the things that hold drinking water, bathing water, and plumbing water. So New Yorkers in Central Harlem, where we're standing right now, can still safely drink tap water, bathe, shower, cook, use your air conditioner. Those things are safe. Our responsive team of experts in data and our disease trackers are monitoring and looking for new cases actively as we speak. Our data and tracking system is robust and led by experts who do everything based on science. On July 25th, when we became aware of the cluster of Legionella's cases, our response was immediate and multi-pronged. Our inspectors were mobilized immediately to sample water from the cooling towers and take them to our public health lab. We were able to identify 11 cooling towers that tested positive for Legionella bacteria on a rapid test. All the buildings that were tested positive have been sanitized, remediated, and treated with antibacterial treatment. To keep the community updated, we're using our media partners and running ads on Link NYC across Central Harlem and several radio stations. We're speaking to community members in their preferred language, and we're also making sure that New Yorkers know that the people at risk most from Legionella bacteria are people who are over the age of 50, people who have immune systems that aren't working perfectly, and people who are smokers or who have chronic lung disease. If you have any flu-like symptoms and you live in Central Harlem, in these 5 zip codes that are under investigation, my ask as the city's doctor is that you immediately call your doctor, and if you're really feeling sick, go to the emergency room or to urgent care. The faster you are tested and then potentially treated, the better your outcomes will be. Legionella's disease is completely treatable with antibiotics, and the outcomes are excellent if it is diagnosed early. The symptoms to look out for are cough, fever, chills, muscle aches, shortness of breath. And again, timing matters. As the council members, assembly members, and senators said, please do not wait to seek care. Finally, we plan to do whatever it takes to keep our communities healthy and safe. If you or your family, friends, or neighbors have questions, please visit us online at nyc.gov/Legionnaires for daily updates, including new hospitalization data. That you can also call 311 if you have questions. Thank you for your time.
Thank you. So we'll take some questions on topic. Yes.
So everything I've heard so far is the kind of thing that you guys have already put out. I was hoping to come here and find new information.
This has been breaking news.